So we're here today at the 5th Annual Glaucoma Patient Summit in Long Beach, California. Joining me is...
I am Dr. Robert Kinast. I'm an ophthalmologist, glaucoma specialist at the Brizette Eye Institute in Portland, Oregon, and I also invented an eye drop aid called the GentleDrop. GentleDrop is extremely simple. It's just a silicone sleeve that fits on an eye drop bottle, 5, 10, and 15 millimeter bottles. Then it has a nose bridge here that goes on the bridge of the nose. Tilt your head back, and it just perfectly aligns the eye drop bottle. Couldn't be simpler. I tried to teach my patients how to, different techniques of using the bottle to fit, to rest on the bridge of the nose, or there's some, actually on glaucoma.org, there's some directions, and I couldn't get my patients to do it well. We've done 2 studies on GentleDrop. They're both published in Ophthalmology Glaucoma. The first one was on 50 patients with glaucoma. 47 of the 50 preferred GentleDrop over their own technique. So once that study came out, we decided that, we should actually start selling this because it can really help a lot of people. GentleDrop also improves safety, success, and satisfaction. So our second study was on low vision patients, and again it showed that GentleDrop improved safety, success, and satisfaction. Interestingly, it also improved independence, which is huge not just for low vision patients, but also their caregivers.
So when you mention independence, it's their ability to administer drops by themselves.
Exactly.
How does GentleDrop contribute to better medication adherence?
Adherence is so multifaceted. There's lots of reasons that contribute to adherence. But if you hate putting eye drops in your eyes because it's, because you're hitting your eye and you're wasting drops, then it makes it much more appealing to put eye drops in, knowing that it's easy and comfortable and you're not wasting medication.
How easy is it for glaucoma patients, including those with limited dexterity or visual impairments, to handle and operate?
Yeah, I think it's easiest just to look at the results of the studies. We had 80 patients total. The amount of contact that it decreased, of bottle tip contact against the eye, was unbelievable. And when we looked at a sub-analysis just at the cornea, in 0 patients in our studies, the bottle tip touched the cornea, and the rates were over 20% with their own technique. And again, decreased drop waste, increased satisfaction, decreased trauma. So we didn't look specifically at people who identified as having tremor or not. So I think it would just depend on how much of a tremor you had. It increases stability. So when you press this part against the nose, if you have a tremor, you have an additional assist. But if the tremor is severe, that there's only so much the assist is going to do.
How can patients benefit from attending the Glaucoma Patient Summit, in your opinion?
I think glaucoma, it's a very scary word. It's a scary disease. What I'd like to see more from meetings like this is an effort to decrease anxiety and decrease fear, which is its own burden on this patient population. And one of the challenges when you're talking about devices that can help monitor home pressure all the time, and talking about all the things that you can do to empower yourself to treat your glaucoma, it also can, at the same time, accidentally create a lot of anxiety and fear about a disease that's inherently terrifying. So I'd really like to see more of an effort to address the anxiety and the fear. I think that would be a tremendous help to glaucoma patients.
Are there any tips or recommendations you have for patients on using the device?
Yes, thanks for asking. So the key to successfully using GentleDrop is putting your head back far enough. If I tried to put it in like this, the drop's just going to fall straight down onto my shirt. And if I just tilt a little bit back, it'll still fall on my cheek. So you really need to tilt your head back. It's a lot easiest to sit in a comfortable chair, like a lazy boy, or even lie down, to really get your head back far enough for good alignment. A second tip is that if you squeeze at the bottom edge of GentleDrop, right here, you can indent the bottle. The bottle's more pliable, right at the edge. And then the third one is, if you're struggling, just have a friend or family member watch. They can just help fine-tune things. And once you get the muscle memory down, you're great. In our studies, we did a 2-minute teaching intervention. So that was the benefit. And having somebody watch you for 2 minutes can really help out, especially for the low vision patients.
I kind of want to touch it. I haven't had a chance
please.
to. Okay. Yeah, so it's still very malleable, easy to push.
And again, it fits 5, 10, and 15 millimeter bottles. It does not fit 2.5 millimeter bottles like latanoprost. If you want to use a prostaglandin, you can use the 5 ml Lumigan. And it doesn't fit irregular shaped bottles like Roto. It is available at Amazon for $14.99, or you can go to our own website, dropbetter.com. And our goal is to help glaucoma patients and help anybody who struggles with eye drops.
Thank you so much.
Thank you.